Welcome. Thank you for joining us. This is the last in our webinar series about CVI for medical professionals. We'll be talking about what happens after the CVI diagnosis, about the next steps, referrals, recommendations, services, and resources that you can provide to your patients and their families. I am Rachel Bennett. I'm the Director of CVI Now here at the CVI Center at Perkins. I'm also a parent to my son Henry, who's 11. He has CVI and other disabilities. His CVI was missed until he was 5.5. And I know what it's like to be a parent, raising a child, not knowing he has CVI, but seeing his struggles and his difficulties and not knowing how to help him. And I also know what it's like when we got the CVI diagnosis, the clarity it provided. I could be a better advocate, and now he has access to his education and he's on his own path to becoming a reader, writer, and problem solver. I am joined today also by Lacey Smith, who you'll meet in a few slides, and she'll introduce herself. A CVI diagnosis is a big deal, and it has a direct impact on the ability for the patient to access services, adaptive materials, and specialized interventions and instruction, all to improve quality of life. A CVI diagnosis enables parents and caregivers to deeply understand their child, the why behind all they observe, and to help them become better advocates for their kids. There's a quote here by a CVI parent who shares her reaction on the day her daughter got her CVI diagnosis. And this parent says, "On that day, I realized my child has a lifelong disability that will forever impact everything she does in her daily life. And it was going to be a constant struggle and fight for her to access the world around her. Until then, I had been prepared to deal with medical scares and motor delays. But the CVI diagnosis changed everything about her access to the world, education, and future employment." Even with CVI being the leading cause of childhood blindness and low vision, the majority of CVI caregivers do not know their child has CVI. Less than 20% of kids with CVI in the U.S. are diagnosed. This is from a recent prevalence study completed by the CVI Center at Perkins and McKinsey & Company. The study found that there are at least 180,000 kids in the U.S. with CVI, and this is very likely an underestimate, and we need more prevalence research to truly understand the full scope of CVI. Many caregivers have to travel long distances to find a medical provider knowledgeable about CVI evaluation and diagnosis. Many with CVI do not get a timely diagnosis, but this is changing in certain regions in our country. In general, there are a lack of recommendations and next steps given at the time of diagnosis. We want to speak briefly about some advice and tips related to the clinical visit from a caregiver perspective. First, this quote from Dr. Barry Cran, a leader in the CVI field, really resonates deeply with the caregiver community. A patient is neither uncooperative nor untestable. It is the responsibility of the provider to create an environment where the patient can be successful. Once the proper environment is created and trust built, it is typically possible to assess basic clinical information such as acuity, and to also assess how the individual uses their vision. Adjusting how to engage a patient with a particular test, as well as adjusting the environment to determine the impact on performance, allows for not only the successful acquisition of data, but it also allows for observation regarding how the task and/or environment can impact the use of vision. I can't tell you how many times I've seen the words uncooperative or untestable on my son Henry's medical reports, when I know a lot could have been done during the clinical visit with the environment to help support his success and to help his providers get the information needed to support our next steps in his medical journey. Here are some tips from our parent caregiver community related to the clinical visit. Know the profile of your patient and medical community. Provide a quiet space for the patient while they wait for the visit to begin. And assess your environment. Ask a lot of questions. Does it benefit the patient and set them up for success? Is the patient facing a cluttered area? How can visual clutter be reduced in the clinical space? Is the lighting dim or bright? What does the patient prefer? Does target lighting support your patient and support your evaluation of the patient's use of vision? Are there distracting noises in the environment? How many providers are in the room? Truly asking the parent caregiver what needs to be in place for a successful visit is going to be paramount. Allow your patient time to respond. Some individuals with CVI may benefit from increased wait time to become aware of a target and establish visual attention, and to even establish visual recognition. And always take the parent caregiver lead. They know their child best. We have the most observational data of our kids across environments. Ask us questions. Be curious about our kid. We want to note briefly about the importance of early diagnosis. If you suspect a child may have CVI, refer and collaborate with other medical providers to support a diagnosis if it's present. Without a diagnosis, young patients may not be able to qualify for early intervention or other state services, and your older patients may not be able to access state services, adaptive materials, and educational services. And if it's still difficult to diagnose, closely and frequently follow up with the patient and document in medical report the concerns about visual development and need for further educational evaluation. Next, you'll meet Lacey, who's going to talk all about referrals and recommendations to include in the medical reports and all of the resources available for your patient and their families.
Thank you, Rachel. My name is Lacey Smith, and I am the CVI Parent Community Manager here at the CVI Center. I am also a TVI and, most importantly, a CVI mom. Fortunately, my daughter's CVI was caught early, most likely due to her medical history of a grade 4 brain bleed, hydrocephalus, and only later did we learn that she had an ultra-rare genetic syndrome that's associated with CVI. So let's talk about the importance of referrals and recommendations. The medical report holds weight. Patient care is empowering caregivers with information, resources, and next steps. The medical report and recommendations hold a lot of weight and can support families and caregivers to take the right next steps in navigating educational, therapy, and state services. For many caregivers, this is the first time we are raising a child with disabilities, and our child is the first person we are close with that has blindness and low vision. We need help and support. A CVI diagnosis. Considerations for the medical report. Use strength-based wording in reports and avoid terms like uncooperative. Use inclusive, non-ableist language. Provide key observations from clinical exam to give an understanding of how the patient is accessing the environment and task. For example, they may have reliance on touch or benefited from a certain auditory or lighting cue to visually attend. Show how they are and are not using their vision. Discuss co-occurring ocular conditions and how they may compound with CVI. Be specific about the impact of CVI. The diagnosis of CVI prevents the child from accessing educational material. Referrals for vision services. State blind programs and services such as Mass Commission for the Blind. Legal blindness determination. Each state has its own definition of eligibility based on visual acuity, visual field deficits, or the diagnosis of chronic causing disability. Document the medical necessity for vision services in early intervention, in the school system, in college, or adult rehab and vocational programs. Educational services and resources through the state or nonprofit organizations support kids, students, and families by providing educational support from a teacher of students with visual impairments, orientation and mobility specialist, certified assistive technology instructional specialist for individuals with visual impairments, eligibility for federal quota funds for accessible materials from American Printing House for the Blind. Include recommendations for educational evaluations when referring for vision services in EI or the school system. So, for example, what needs to be completed by a TVI? A functional vision assessment, which looks at any possible eye conditions that might also be impacting the child with CVI, and how the child uses and doesn't use their vision to perform everyday tasks. A CVI assessment, which is a comprehensive evaluation that assesses the impact of the CVI visual behaviors on access to learning and the environment and the use of compensatory skills. A learning media assessment evaluates sensory preferences the child will use to access learning. For example, pictures, tactile, adapted print, braille, auditory, and digital. Include an orientation and mobility assessment, which should be completed by an orientation and mobility specialist. This evaluates the environment's impact on your child's learning and safe navigation, and to determine which supports will help the child move through his or her world safely. An assistive technology assessment, completed by a certified assistive technology instructional specialist. This will evaluate where the barriers exist to access and how to remove those barriers using assistive technology unique to the child's need. Evaluations from TVI, O&M, and CADIS are essential for students in ensuring access to specialized services, instruction, accommodations, and programming that allows full participation and access to their education. We have a growing suite of CVI assessments. A functional vision assessment for CVI will focus on how the visual behaviors impact access to learning and include a parent interview, observation, and direct assessment. Inventories and screeners include Dutton's CVI inventory, Ortibus Flemish survey plus Teach CVI materials. Tools to support functional vision evaluations include Perkins CVI protocol, Roman Lancey's CVI range, Walroth and Stedman's visual assessment scale CVI. And then there's the need to know the most accessible learning media materials, technology, and presentation through the learning media assessment, Matt Tejan's 2D image assessment, the expanded core curriculum evaluation and skills assessment, assistive technology evaluation, Patton's considerations for educating students with CVI, and orientation and mobility evaluation to ensure safe navigational skills. You can learn more about the assessments at cvinow.org, Getting Started with CVI Assessments. It's important to always remember inclusion of diverse CVI manifestations and experiences. With CVI, every individual person's lived experience is different. All types of manifestations of CVI are a big deal for the person. People with CVI are the experts of their own brains. There is no one single trajectory for a patient with CVI. Fundamentally, it's about agency, choice, and access. There are many ways to access information. It's not just about vision. Compensatory skills don't take away from vision use. Some with CVI use vision, some use non-visual skills, and most use both. In the next 3 slides, I'll talk about recommendations for general CVI supports. I'll start with a suggestion. Clinicians make a dot phrase in the EMR to provide these general recommendations to all individuals with CVI. So some examples of environmental adaptations: maintain a predictable and organized environment, reduce visual clutter in the learning space, reduce noise and distracting light, overhead light from the windows, and reduce distracting movement, high traffic areas, peers passing by, or working in a group nearby. Use supportive positioning. Students should be fully physically supported for learning, tasks, and activities. Leverage color and contrast. Examples of supports for learning tasks: require specialized learning. Use IDEA language. Benefits from multisensory approach to learning: visual, tactile, auditory, kinesthetic. Adapted, accessible learning materials and presentation in the accessible visual field. Allow the student to focus on one task, sensory input, output at a time. For example, listening only, looking only, or touching only. Reduce visual clutter and crowding. Show one thing or a few at a time, depending on the child's needs. Intentional use of color and contrast, bright, bold color. Intentional use of light. Use backlit devices or task lighting to support visual attention and recognition. Allow for wait time. Include general information on CVI. General definition of CVI and how the specific patient is impacted by CVI. Visual behaviors commonly seen in CVI. Visual fatigue, a common shared experience among individuals with CVI. For many with CVI, vision is not reliable at every moment of the day. Vision can be affected by both internal and external states or stimuli. Vision use is not passive, it's hard work, says Nye, an adult with CVI. And Dr. Lofty Mirabet states, with an increased visual load, individuals with CVI have to grind it out. Serial versus parallel processing, which eventually leads to frustration and anxiety. This perpetuates throughout the day, causing this vicious cycle of fatigue and stress. And lastly, let's talk about CVI resources. CVI Now empowers parents, caregivers, and professionals with resources, tools, and services to advocate for and support individuals with CVI. So what does that look like? Well, you can go explore the website and find what is CVI, understanding the CVI visual behaviors, getting started with CVI assessments, CVI Now Early Intervention Series, the CVI Now IEP Guide, CVI stories, and much more. At CVI Now, we also offer parent support and programming. We have a CVI Now Parent Caregiver Facebook group that's safe and it's inclusive space with rich discussions. We have one-to-one CVI Parent Caregiver support sessions, CVI Parent Caregiver community chats, Parent CVI Learning Series for various topics on CVINow.org. CVI Scotland. CVIScotland.org is a comprehensive site that offers information about understanding, assessing, and supporting individuals with CVI. It's packed with medical information, educational resources, blogs, and videos from people living with CVI, research news, and plenty more. Nicola McDowell's blog, who's an adult with CVI, Yellowstone's blog, who's a teenager with CVI, and the CVI Sim virtual reality videos. Other trusted resources. Perkins.org. Perkins.org offers Perkins eLearning, Transition Planning Resource Center, the Perkins Library, and much more. Active Learning Space offers total approach for promoting the development of people with severe multiple disabilities and supports learners to be active participants in their surrounding. The American Printing House for the Blind, APH, Family Connect, supports people of all ages who are blind or low vision. They provide many disability resources, support groups, advice for working with medical and educational teams, and more. CVI are discussion groups for parents, older children, and caregivers at the C-Lab, a discussion group supported by clinicians, researchers, and teachers of the visually impaired. Pediatric CVI Society, they're on a mission to advocate to improve the quality of life of children with vision loss due to brain disorder, disease, or injury, and many more resources listed at CVINow.org. You can find them at trusted resources for CVI, blindness, and low vision. So some takeaways. CVI impacts multiple aspects of an individual's functioning and a multidisciplinary approach is required. Clinicians may influence a child's development trajectory by providing an early diagnosis and referring to appropriate services. Longitudinal follow-up and communication among members of the care team is key to ensuring an optimal outcome for all individuals with CVI. The CVI Center is urgently confronting the world's leading cause of childhood blindness and low vision, CVI, through education, innovation, and collaboration. Our approach is research-based and whole child-focused. Thank you for your time. Together, we can make a difference.